We use two different formulas to calculate the average blood pressure in our arteries. In our arteries, we can detect two pressures. The higher pressure is referred to as systolic blood pressure. The lower pressure is referred to as diastolic blood pressure. Systolic blood pressure is the pressure that blood applies on the wall of the artery exactly at the moment that ventricle contracts, and specifically here we're talking about the left ventricle. So in this image, left ventricle is contracting, aortic valve is open, and left ventricle is pushing blood into the arteries. When blood flows through these arteries, it applies pressure on the wall of these arteries. And when exactly at the moment that ventricle contracts, we measure the pressure in the artery, we name this higher pressure systolic blood pressure. When left ventricle relaxes, means it no longer pushes blood into the arteries, we have a remaining pressure in the arteries. It means that blood still is pushing the wall, but this would be the lower pressure. And we refer to this lower arterial pressure as diastolic blood pressure. Let's recall that the most common artery that we use to take the blood pressure, find out about systolic and diastolic blood pressure, would be the brachial artery. And now we are ready to use systolic and diastolic blood pressures to find out the average blood pressure in our arteries. One formula is this. We just need to add diastolic blood pressure, the lower pressure, to 1/3 of pulse pressure. When we say pulse pressure, we mean the difference between systolic and diastolic blood pressure. For example, if in an average size adult at rest, systolic pressure is 110 and diastolic is 70 mm of mercury, the pulse pressure would be 110 minus 70. That equals 40. So 40 is the difference between systolic and diastolic, and what we need here is 1/3 of the pulse pressure. So 1/3 of 40 equals 13.33. We just rounded up to 13. So now we are ready. We found out that 1/3 of pulse pressure in this case is 13. We just add that to the lower pressure, diastolic blood pressure. So as you see, 70 plus 13 equals 83. It simply means in the individual that we talk about, the average blood pressure in the arteries would be 83 mm of mercury. Another formula to calculate the average blood pressure is this one: cardiac output times systemic vascular resistance. This formula is used commonly to make sense of the factors that impact the blood pressure. For example, we know we calculate cardiac output by multiplying stroke volume and heart rate. So any factor that changes heart rate or stroke volume changes the cardiac output, and as a result impact the blood pressure. Also, we know the three main factors that impact the systemic vascular resistance would be the diameter of systemic blood vessels, especially the arterioles that we have in our different systems, the length of blood vessels, and the thickness of blood viscosity. Either one of these factors changes, that leads to the changing of systemic vascular resistance. And for example, if systemic vascular resistance increases, blood pressure increases. If systemic vascular resistance decreases, blood pressure decreases. Please make sure to review the video that I talk about the calculation of cardiac output or the factors that change stroke volume and heart rate, and also the video that I discussed these three factors that impact the systemic vascular resistance in more detail.